Good morning to one and all. I am honored to welcome our chief guest, Dr.B. Ravishankar sir, Managing Director, Omega Hospital. Dr.B. Ravishankar is a clinical oncology professional with over 20 years of rich experience in clinical research, teaching, consultancy, majorly in head, neck, oncology, breast and gynec oncology. His educational qualification. He pursued his MBBS from Sri Devaraju Medical College, where he was a gold medalist. Then he pursued his MD from CMC Velluru. Later, he qualified DNB 2001 examination from National Board of Examination. He completed his FRCR in clinical oncology from Hong Kong in 2007. He also completed his MBA Hospital Administration in 2016 from Andhra University. He started his career as a radiation oncologist at Christian Cancer Center, Kakinada in 1997. Later, he worked as a consultant radiation oncologist in Lions Cancer Hospital from 1997 to 2005. Later, he worked as assistant professor in Kakatiya Medical College, Warangal and Andhra Medical College, Visakhapatnam. Later, he worked as senior consultant in Queen's NRI Hospital. Currently, he is the managing director of the Omega Hospital. Awards. He was awarded the most trusted oncologist in Visakhapatnam in June 2021 for his excellence and leadership in healthcare by Golden AIM Awards. He was awarded Service Excellence in Radiation Oncology by Times of India, Times and Health Excellence 2020-21. He attended various national and international conferences as speaker, such as the UAE Cancer Congress held in Dubai, 7th World Congress on Healthcare and Technology held at London, UK in 2016. He has also published several articles in prestigious national and international journals. He also conducted various workshops and conferences on oncology as organizing secretary, such as Onco Meet 2004, 2006, 2007, 2008, and Best of Astro 2017, etc. This is a brief introduction of our Honorable Chief Guest, Dr. Ravishankar sir. It is a pleasure to have him in this webinar. Thank you.
Thank you, Srikar, for your good introduction about the resource person. Now I request Dr. B. Ravishankar Garu to give his valuable talk on this cancer business program, sir.
Good morning, everybody. And thank you very much, Archana Garu, for giving me this opportunity. And you made a big effort to make a good platform to interact with all your faculty as well as your students. So it was a very good effort. Let me share my slides.
Okay, sir.
Thank you very much, respected principal, and that was a good introduction by the student. I really appreciate it. Thank you very much. So today we are here to know about cancer. Why we have to know about this cancer? Because if you look at the trend, it's just going up. So that means the number of cases that are suffering from cancer are increasing day by day. It's not only the situation in Vizag or in India, in the entire world. And definitely, we know that these are all the cancer survivors. We know some of the major big politicians, some of the cinema actresses whom we know, and some of the actresses of abroad like Angelina Jolie. All these renowned, prominent personalities were treated for cancer, and they are all survivors. You know, like Manisha Koirala, Yuvraj Singh, many of you must be knowing Yuvraj Singh. So, what makes us to think about all these persons is like you can also win against the cancer. That is something that, so morally, this will give you a positive attitude that such and such person had the disease and he is now doing very well. So, we don't have to worry about the disease. So, that kind of a positive impact it can give you. And in general, what makes you worry is because if you look at the individuals which are suffered from cancer previously, that is about 25 to 30 years ago, this used to be the disease of elderly people, that means old people. But today, this is shifted to the younger generation. And unfortunately, if you look at the scenario in India, the breadwinner of the family are getting affected by this miserable disease, and the whole family gets shattered because of such an disaster. So, other thing is the rising numbers, as I have already mentioned. And in spite of having so many interactive sessions, so much of information that is put into the public, still many of our people, they don't know exactly when to consult this doctor. And most of the times, it is, I think, probably 2/3 of these cancers, all these patients present with advanced disease. That is because still there is lack of awareness, and there are no particular guidelines for screening in India. And the most fearsome of all these things is these cancers, when they affect younger people, it is going to be really aggressive. So, what are the main types? See, unfortunately, this cancer can affect anywhere in the body, right from the toe to the head, and it can affect any tissue in the body except the nails and the hair. So, you can have lung cancer, you can have stomach cancer, you can have liver cancer, you can have colon, breast cancer, cervical cancer, and head and neck cancer, so on and so forth. So, the list is big. So, why is that they get cancer? The basic mechanism is basically all the cells which are in the body are having certain type of control by some genetic system. Say, for example, it is controlled by a switch. So, when the switch is not working, probably you will be exposed to either high power or no power. See, similar situation, if this genetic system is damaged, so how do they get damaged? Either it could be an exposure to the environmental toxins, or it could be virus, or it could be because of his own self-inflicting wounds like lifestyle, or in about 5 to 7%, it can be hereditary, which runs in the family. So, what lifestyles make them more prone for cancer? Inactivity and obesity. Today, we know that children are more inclined to in-house games. They want to spend more time with the TV, gadgets, and all that, and they want to consume unhealthy food like burgers and fast foods like hot dogs and all that, and all this noodles. So that increases the dietary fat as well as meat consumption with no activity, and there is prone for obesity. So with all these things, there is a very high chance for getting breast cancer and colon cancer. If you start consuming high calorie diet, like more of fats, unsaturated animal fat, that you get it from red meat, like it could be beef, or it could be mutton, or it could be pork. So those things are pretty dangerous, and so there is a very much high incidence of cancer breast, endometrium, colon, and gallbladder among these patients who consume very high calorie diet. And of course, alcohol increases the risk of cancer, but it always promotes rather than initiation. That means the cancer process doesn't get initiated by the alcohol. It only progresses if there is an already initiation. So there is risk of mouth cancer, throat cancer, and food pipe cancer and liver cancer with alcohol. Of course, we know that tobacco is the major culprit. I must say that tobacco can cause cancer in many organs in the body, and we know that it is being consumed by different methods, like it could be a cigarette or a cigar. People start chewing this tobacco in the form of Panparak, Deluxe, and all those different names, and they put you at high risk for throat cancer, that is larynx and pharynx, and the food pipe like esophagus, and the lung cancer and stomach cancer. So environmental factors. If you had ingested the chemicals that, so all the frozen food and all the fast foods and all, you have ready mix, all these things, definitely they contain a lot of chemicals. So and beyond that, we also get exposed to a lot of chemicals that are being produced by the industry. Vizag is being one of the industrial hub, so we all must be careful that we may get exposed to many polluting chemicals in this environment. Of course, definitely we are not having any asbestos factory or cadmium or uranium here, but nickel could be one culprit, and vinyl chloride, benzene, all these things can happen in any of the petrol and paint industries. Radiation, of course, environmental. Definitely, I don't say that Visakhapatnam has got any background radiation or anything like that, but definitely there are certain areas in the world where there is undergone background radiation is responsible for carcinogenesis. Certain microorganisms like viral infections, which I'm going to tell you later, and if there is an exposure to the ionizing radiation, that is in the form of X-ray or UVAs. So these are the viruses which I want to tell you that cancer also can be caused by viruses. Like for example, if you take Burkitt's lymphoma, it is usually caused by the Epstein-Barr virus, and cervical cancer. It is also a very common cancer among the women, especially women, residing in the rural area. So it is nothing but the lowest portion of the uterus is the cervical cancer. So that is very commonly been caused by the human papillomavirus. We have enough and a lot of evidence to say that HPV causes cervical cancer, and hepatitis B causes liver cancer. Hepatitis C also causes liver cancer. Human T-cell lymphocytic virus causes leukemia, and Kaposi sarcoma. Associated herpes virus causes Kaposi sarcoma. That's more common among the HIV patients. So, otherwise, if you take in general, what are the risk factors for this? As you grow old, definitely you are put into a high risk for a cancer, and overexposure of estrogens. These days, we see a lot of children getting married, and they want to postpone their pregnancy, and they use a lot of hormones. So that is not ideal. If it is necessary, probably you may use, but otherwise, if it is possible, I think they should finish off their pregnancy as early as possible, so that the mother gets protection from breast cancer, and it is always good for the family. And of course, as I mentioned, family history, hereditary, family environment, lifestyle, all these things also increases the risk of cancer. So when do I suspect? Unfortunately, these cancers, they do not have any specific symptom or a sign which say that, okay, this is seen in this patient, so it is cancer, or this test is done, so you put them on and say that this is cancer. Like that you can't say, because it is a generalized symptoms and generalized behavior. So in most of these patients will have either thickening or lump in the breast, or any obvious change in the water and mole, or if there is a sore which does not heal and there is a nagging cough which doesn't subside with the routine medication, or sudden onset of harshness of voice, that means change of his voice or her voice, and change in bowel and bladder habits. That means either it could be diarrhea, or it could be constipation, it could be increased frequency of urination, or it could be not passing urination, and indigestion, difficulty in swallowing, unexplained weight loss, and unusual bleeding or a discharge. These are generalized symptoms. If anyone has got any of these, probably you must investigate further and to rule out whether is there any cancer underlying disease in that individual or not. So what we know about India is that the second largest tobacco consuming nation, and of course there is a trend towards use of tobacco is increasing by different forms. And if you take the total population, almost 35% of them are tobacco users. And again, if you see in the gender-wise, I think close to 50% of the male and 20% of the females are using tobacco. This is something really bothering because there is increased tendency among the young females using this, getting addicted to this tobacco. So, of course, number of smokers, as I mentioned, even females in India are increasing rapidly. And probably, I think, because the culture is changing and they also do night shift and they want to do the night shift. So, they just have, there's so much of work pressure, peer pressure, and all these things. So, maybe there are other ways to come out of this pressure, but not the only smoke. So, they have to chill out and come out with this pressure. So, but don't get addicted to tobacco. Tobacco is dangerous, and in women it is more dangerous. The reason because if an individual who is male is consuming tobacco and you compare with a female, the female gets affected more because she produces more toxins from the tobacco. So once you consume tobacco, tobacco gets metabolized. So the metabolizing capacity into harmful ingredients is more with women. So that's why women is more dangerous than men using this tobacco. Okay, so this is just a hint that it can kill about 1 million Indians a year, and I think it's about 60 to 70% of the cancers are related to tobacco, and India has the fastest rise in tobacco related deaths, definitely. So say no to all these kinds of things, like either it could be chewing or gudka or hookah, which is more common among the young kids going to all this new pubs, and this is of course smoke. So yeah, and some colleges, I think 70% of the students they consume tobacco, which is very shocking, and 65 to 70% of the students can start before the age of 10 years. See, all the kids, they may not know how to spell tobacco, but they start using this. That's more dangerous. So these are different types of tobacco that we have in the market. So two basic smokeless are like chewing tobacco. Of course, snuff these days nobody uses. So according to the WHO, approximately 1 person dies every 6 seconds due to tobacco, and it accounts for about 1 in 10 deaths. So it is a major killer. So once the tobacco damages the cells, there is a genetic damage. That genetic damage makes the cell grow uncontrolled, leads on to cancer. So this is what happens, and whatever tobacco causes DNA damage, which leads to the cancer. So this is about that, and I'm showing you that it can cause mouth, nose, throat, larynx, trachea, esophagus, lungs, stomach, pancreas, kidneys, ureters, bladder, cervix, bone marrow, and blood. All these organs can get affected with tobacco. So before you light your next cigarette, think about and remember this picture. You should not be in the picture like this. So try to remember, and if you have anybody at home, I think it's time to just put pressure on them and stop the consumption of tobacco. So this is how the normal lung tissue looks like, and this is the deceased. And I'm glad that many of you have already drawn wonderful pictures, and those posters are extremely good, and in a short notice you made wonderful posters. Anyhow, we'll come to that later. So these are the other risk factors that can cause lung cancer. As I've already mentioned, these are the chemicals, and radon from the background and asbestos and all that. Okay. So this is a little, so though we know that lung cancer is very common, and even if you try to do an early CT scan and try to diagnose this lung cancer, it's very difficult because a major trial in United Kingdom failed to show that there is importance of doing a CT scan early and intervening early for lung cancer high-risk patients. So only thing is, when he starts having symptoms, immediately you have to do a CT and find out whether it's related to lung cancer or not. So coming to the other important cancer among the women, that is breast cancer. So in almost like women have 1 in 7, they have a very high chance of getting this breast cancer, and the chance of dying from breast cancer is 1 in almost 33, and of course the breast cancer related deaths are going down because there is improved chemotherapy and radiotherapy and surgical modalities that are in breast cancer, and lots of newer advanced techniques have come into picture. So how do they screen? Screening means it is done for an individual who is not having any disease. So normal individual. So 40-year or older, yearly mammogram and clinical breast examination. If it is something like 20 to 30, clinical breast examination alone, because we don't want this group of women getting exposed to mammogram, because that has got again intense radiation. So at any age, probably if you find any changes in the breast, you can always report to the doctor and then discuss with them and show it to them, and if they find that there is something suspicious, probably they will investigate further. So these are the different symptoms and signs that you see. There could be a lump like this, or there could be some discharge from the nipple, or if there is any contour of the breast is changed, there is some dimple over here, or is a protrusion, or if there is inversion of the nipple, that means the nipple is indrawing and it's going inside, or change in the color and appearance of the areola, or if it becomes red or something like this. So these are the signs and symptoms of breast cancer. So the best way to protect one is that you have to do a triple, that is a mammogram, a clinical breast examination, breast self-examination. Breast self-examination, I'll show you how you have to do. So this is how you have to do your breast self-examination. When you're taking bath, you can just look at your body in mirror and see if there's any indrawing of the nipples, and see the level of nipples, both are at the same level or something is going up or something is going down. And then when you're lying down, you can do palpation of that. When you're taking shower also, you can do a palpation of in a very processed manner, that is in the clock way or in an anti-clock way, anywhere. But you can use these 3 fingers to palpate. So preferably it should be done 5 to 7 days after your periods. And if it is menopausal, that means those who have attained, those who have got stopping of periods, then maybe you can do once in a month on this similar day. If somebody is pregnant, each month on the same day, and it takes about 20 minutes for you to perform your BSE. So this is a mammogram where you can detect which cannot be palpated, that means which cannot be felt by you on your palpation, can also be seen by this. This is a mammogram. This can detect a very early breast cancer. So screening and diagnostic mammogram, you can do ultrasound in young patients, you can do MRI for a patient who has got family history or a dense breast. Some people will have dense breast, for them you can do an MRI. Biopsy, if it is necessary, you will have to do, and other tests, if they are necessary, they will do the tests. And of course, the staging wise, you have got different stages, like if it is just confined to the duct, it is the ductal carcinoma in situ. If it is confined to the breast, it is just early breast cancer. If it is increased in size locally, then it is stage 2. If there is involvement of axillary nodes, then it is locally advanced. Then if there is a spread to the other areas in the body, like from breast to some other area like bone or liver or lung, then it is called metastatic or stage 4. So like you have surgery and radiation and chemotherapy for all these patients which are available today. And the other important cancer among the women is the cervical cancer. So primarily it is caused by HPV, so the human papilloma virus. We have got different varieties of virus. So of this, between 12 to 14 are very high risk for this cervical cancer, but not all. So always you can prevent, you can detect early, and you can treat them comfortably. So this primary cause of cervical cancer, as I mentioned, it's HPV. So when it's found, it can be treated early, and usually the symptoms do not appear until there is an erosion of the cervical mucosa. HPV vaccination is excellent one, which can be taken by many of the girls today, and it is preferred usually after menarche. That means after attaining the menarche, once you start having your cycles, I think you must go for this HPV vaccination, and it's about 0 to 6 is the schedule. You can always get, and you can protect yourself. Earliest is the best. Before you get married, if you get HPV vaccination, you get about 70% of protection from the cervical cancer. So otherwise you can do a screening which can begin after 3 years after you become sexually active, or after 21 years. So you can always get this pap smear. This is a smear that they take it from the cervix, and it's very simple and cheap technique, nothing to worry. So if you want to see how you want to intervene at that is at the time of menarche, you can do what is called primary prevention by giving HPV vaccination. Women who are more than 30, you can always screen them and catch them early. Those who are already been diagnosed, you can do any of these methods, that is tertiary prevention. So how do you reduce your risk of getting this cancer? I think probably you'll have to stick to the guidelines, and you must always know your family chart. Is there anyone who has been affected by the cancer? Always eat healthy and balanced, and which has got good micronutrients. Do some good regular exercise. Don't go for smoke or any of these kind of tobacco products. Avoid using excessive alcohol consumption. Use the slip, slap, slop method for skin protection. Okay. So as I mentioned, it's about 2/3 of all cancers are basically related to tobacco, and nicotine replacement therapy can be done if somebody is already been getting hooked to the tobacco. And one important thing is that you should always make yourself that you don't smoke in the house, or you don't smoke in the your workplace, so that is something like, like if you have a fixed idea, that's how you reduce yourself getting exposed to this tobacco. So this is already been told you, that physical activity and all that, and eat everything. Like we always get a lot of questions from various people that should I eat this, should I eat that, should I eat this, should I eat that, and all. So try to eat all kinds of fruits and all kinds of vegetables. Everything has got wonderful effect in preventing cancer. This has all been given by the nature. Nature always protects you. So consume whatever is seasonal fruits and seasonal vegetables, all these things, and maintain good healthy weight, and try to consume, like I don't like this apple, or I don't like capsicum, like that. You don't have that food facts. Go for everything, eat everything, and of course avoid tobacco. Go for good dietary fiber, exercise, skin protection, and all these things I've already told you. So our ideology is to make this high quality treatment available, like which has that accuracy and precision, with an high quality, and we believe in that maintaining high quality with a lot of precision. And of course, as an oncology group, we always come forward to help the patients as well as the patient relatives with the best of our knowledge in the technology. Of course, if you look at this capital Calvin's, giving is not just about make a donation, it's about making a difference. I think that's what is expected from all of you, because you're all educated and you can make the difference. Together you can always make the difference in the society, and which really impacts many and many lives in future. And with this, this is our treatment machines that we have. And thank you very much. And once again, I thank ABN College Principal Sir and Mrs. Archana and all other participants for giving me this opportunity. Thank you very much.